We have Patty Holden here this evening, and she is not feeling well. We're thankful she's here. She has come down with a cold. So we're moving her up a little bit in the agenda than what was already planned. So, Patty?
It's my pleasure to be here. I don't think I would have missed this for anything. So you might want to spray this microphone when I'm done. I'm going to need that.
She knows how to find a doctor.
Again, I'm representing not just the hospitals, but all of healthcare. And there's a number of providers here. So it's my privilege to address it as an industry, not just the hospital itself. Although I have to show a picture. All right, I came here about a little over a year ago now. And it's been my pleasure to work with such a great group of individuals, not just the team at the hospital, which I'm very proud to be a part of, because they provide award quality winning healthcare constantly. A little brief history on the hospital. About a little more than 10 years ago, a concerned group of people got together and said, we need to have something here. It will help the community grow. It'll serve the needs of our community systems as community members as well. The hospital was built to grow. It's built to add more floors, to expand, to add more medical office buildings. We just need to get the community involved and growing again so we can continue to grow services. And we're more than just an ER, which goes back to some of the other things. It's easier for me to recruit a specialty physician that loves to golf. You know, it's a great community to raise children. You know, we're doing so many wonderful things here. Of course, here's the impact on the community. Oops. Back. Oh, well, I can't get it to go back. So anyway. You can hit the back button? Oh, I don't want to go there. Anyway, what I was saying was, actually, we have a lot of healthcare providers here. We have a lot of jobs, and some of the specialists, it's not just hospitals, but we have physical therapy, orthopedics, ophthalmology, behavioral health. I mean, there's just a few of them there. Pain management, podiatry. We have dentistry. Oh, Dr. Blaser. You know, but we do have a lot of other services that are here to help the community. It's not just one. You don't have to travel far to get quality care here. Currently, we're looking at a large Medicare population. We want to get that down. And according to our health analytics, just recently came up, the 65 plus population is set to grow another 20% over the next 5 years. But the total population is only going to grow 7%. That's what we want to change. We want to bring the others in. How do we help? Well, when they're talking about bringing in new corporations, new businesses, they want to have that infrastructure there. They want to have healthcare access. It's vital. You bring in more residents, residential locations, retirees, families. We also, healthcare currently employs over 300 people here with a variety of specialties. Living wage jobs. We know that people in healthcare make a little bit more than the average. So they're going to buy more. They're great consumers. We invest in homes, support other businesses. You know, we support education. You know, working with CSN here, we're helping train future healthcare professionals. And that produces great long-term careers. Concerns about the growth. Everybody's had it, every one of us here. Several, last year, or 2011, actually, a number of healthcare providers got together, created the coalition, because we wanted to focus on how are we going to get the community to know that all of these services are here. So that the Healthcare Coalition is building websites. They are not prejudiced or biased against any provider. They're going to provide access to consumers that show everything that's out there, what's available. These are some of the members of the coalition right now. These are the group that got together that are providing that information. They work very hard. You know, again, we've got the College of Southern Nevada, Fit Physical Therapy. Mesa View Home Care, Highland Manor. I mean, there's a large number, and it's growing. Where is healthcare going? Well, right now with some of these changes, it's really hard to tell. We don't know what to expect. But again, healthcare itself is all about change. Medicine has always been about change, new techniques. So we have to adapt. We have to think ahead. We have to think out of the box. What's going to be the best for the community? How are we going to go? Well, we know that they're focused right now on more wellness programs, and that's good. That really is. It's focused on prevention. We've got to take care of ourselves. We've got to think about what's going to be happening. The continuum of care, that is vital. When you're in a hospital and you're getting ready to go home, you want to have those discharge instructions. You want somebody to make sure that you're getting your prescription filled. A phone call a couple days later, are you still doing okay? Making sure that you have access to that home health that might be there. You know, home care focused. The drive right now is to keep people out of a hospital. Keep people home, at work, producing. And all-inclusive medical communities. There was, a couple of years ago, the Catholic Health System down in Las Vegas bought all these acreage in Henderson. They were going to put in a whole community. So it was going to have a hospital, it was going to have a long-term care facility, it was going to have pharmacy, it was going to have everything just in a small radius, so you wouldn't have to travel far. You could get your care all in one area. That's been a little stalled with some of the economic issues, but I think something like that is the way to go. Future, monumental changes are coming. Nobody really can grasp what's going to happen right now, but we know it's coming. You know, I think it's a great thing that more people have access to insurance. It gives them more access to health care. They can continue to contribute to society that way. Healthcare providers, like I said, we have to continually analyze, anticipate the change, be practical, and fiscally responsible in the services they provide. Things are going to be changing. Every hospital is doing it. For example, Scottsdale, we talked about that earlier. Mayo Clinic down there does not even take Medicare patients. They stopped that 3 years ago. They're looking at what's going to be best for the community, how can they serve and survive. And again, healthcare is all about change. Short.